Hello, welcome, and thank you for being a part of WorkSafe's Addressing and Improving Health and Safety Issues in the Workplace webinar. My name is Cameron Ling, and I'll be your host for this session. And today we are exploring the following: the obstacles that health and safety officers can face at work, some strategies and tips for getting over those hurdles, and the value of genuine engagement and communication at all levels in keeping a workplace safe. Today, three workplace health and safety experts joined me for this session. Gai Coles is a clinical nurse specialist and HSR at Barwon Health. Good morning, Gai.
Good morning, Cameron.
It's great to have you with us. Also joining Gai is her colleague, Jen Gamble, who is an associate nurse unit manager and anaesthetic equipment nurse, also at Barwon Health. Good morning, Jen.
Morning, Cam. Thanks for the invitation.
No worries at all. Thank you so much for joining us. And also joining Gai and Jen is Jared Dowswell. He's an inspector and a very active advocate for workplace health and safety in Victoria Police. Thanks for joining us, Jared.
Yeah, good morning, Cameron, and those online. Thanks for having me.
It's great to have all three of you with us. Gai and Jen, amongst their many achievements, have successfully won approval for installation of automatic doors in a sterile storeroom and facilitated the smoothing of marble bench top edges in the surgery hub to minimise risk of soft tissue injuries. Also, on top of that, they won the Health and Safety Representative of the Year category at the 2023 WorkSafe Awards. Jared most recently led the massive remodelling of the Victoria Police Driver Training Centre. This facility has reported outstanding safety results ever since, and he was a finalist in the Leadership Achievement category of the 2023 WorkSafe Awards. Thank you to all three of you for joining us today and being able to share your information with us. We're going to take audience questions a little bit later on too, so please feel free to start entering those questions at any time via the Q&A box there. But let's meet these three inspirational workplace health and safety leaders and drill down a little bit further. Gai, if I could start with you. You and Jen ran a project to stop staff exposure to toxic substances that are used to clean equipment such as bypass machines. What was the catalyst for this project?
The catalyst was helping staff who were decanting this toxic substance, and there were effects felt by staff a whole room away. So respiratory distress and breathing difficulties, which started us on an investigation of what this toxic substance could actually do. So with MDA forms and with ChemAlert, we found that not only did it have respiratory issues, it also had skin, eyes, and fertility issues attached to it. So immediately we engaged occupational health and safety managers and did an audit as well as a risk assessment, and went from there. So the catalyst was somebody having symptoms and a room that was never ventilated or fit for purpose, and the fact that the chemical was retrospective. So the health department changed the chemical that needed to be used to clean the bypass machines, and so this chemical's come into the department without us knowing.
Obviously, some really serious stuff there, Gai. So great work with what you're doing. Jen, what was the greatest hurdle in getting that project over the line, and how did you overcome it?
So really it was, in a lot of ways, it was related to finance. So it was about a 2-year project to try and find a resolution to the problem that we had. The perfusionists, it was their equipment that they were cleaning. They didn't have the capacity anymore with staffing. We looked at different models for how we could potentially resolve it. We worked with management. We considered having theatre technicians, like additional EFT. That was not easily resolved because we couldn't get more staff. It was through COVID. So it was difficult to get more resources in that regard. And so we used the Act, we used the regs, we worked effectively with management, and really we came up that the only solution was to get an external company, some contractors to come in who do it for other hospitals as well, for them to come in and do the cleaning after hours when we're not using the theatre suite in some of the rooms. And then the biggest issue was obviously then getting it over the line with that. And so ultimately we issued a PIN, so a provisional improvement notice, to the organisation. And that really gave the organisation then a tool that they could actually take to finance and say, like, we do need to actually move on this. And and then, we worked very quickly with the organisation. The contractors came in and we now have a safer workplace for it.
Fantastic. Gay, can I jump back to you just on this? You're a HSR in a theatre suite that employs 290 people, a huge designated work group. How did you build and maintain a strong relationship with them in this project so you could advocate with management?
Definitely. It's about collaboration, feedback and inclusiveness. So our staff, it's 270 people, don't realise that's how many people work in an operating suite to get you over the line. So people needed to feel part of this project because intrinsically, anything that we do in the way of health and safety is because our designated work group brings these issues to us. And so we work very closely to make sure their suggestions for improvement and inclusiveness, so the whole team works together and sees there is something happening because they've suggested that this could be a way of fixing it, and give feedback. Always give feedback. People are very anxious to hear that something's progressive or progressing with management. So they quite often will come and ask, how's this going? But we try to give feedback before that. And then we have a very tight group. Works very well.
Oh, fantastic. Jared, if I could come to you now, perhaps. In 2019, you headed up the Vic Pole driver training unit in Atwood. And I believe you noticed that it was far from fit for purpose, with 5 serious collisions occurring in the previous 18 months. How did you approach the overwhelming task of getting the facility and its function back to a safe standard?
Yeah, Cameron, if I can just provide a little bit of context initially, driver training in Victoria Police occurs 2 ways. About 20% of it we do off-road at our Atwood facility, and then 80% is actually on-road. The on-road component is sort of above the speed limit, and that's where we'll actually experience the serious injury collisions occurring. So because I was new to the work unit and I wasn't a subject matter expert by any extent, I hadn't been in the highway patrol or anything previously, I had to understand why this was actually occurring, like why suddenly were we seeing all these collisions occurring on the road network. So to look at that, I went back to, well, when was safety last looked at in driver training? And I was really surprised to see we hadn't sort of looked at safety since 2006, and we're now in 2019, so there was some 15 years. I reported up my findings to my management as a result of that, and then there was an agreement that I could create a project. So part of that project was to discuss with my sponsors, well, what actually is in scope and what is out scope. And it was agreed that we'd look at a 2-facet approach. We'd look at upgrading the facility at Atwood, but also what we could do to mitigate the risk on the open road network. To do that, I actually had to create a team. Like, it's a fairly, well, it is a significant large piece of work that went over a number of years, and you can't do it all by yourself. So part of that was, adopting a small team, but make sure that you have the right people in that team. So I was looking for a bit of independence. I was looking for some subject matter expertise. And I was looking with people with occupational health and safety expertise. Another thing is, understand your processes and your systems within your agency or your organisation, and use that to your advantage. Make sure that your near misses are recorded, that your injuries are fully recorded. If you've got a hazard system, that's sort of recorded, so you've got that strong evidence base to help put forward what you need. Have a good understanding of legislation, occupational health and safety. Like, I used it to my advantage quite a bit because I was in a training environment, and it's a specific part of the Act that speaks to sufficient training and instruction so that people can safely perform their role. Bring it back to risk. Like, always report back to risks constantly in relation to whatever I do. So what my managers basically want to know is what needs to occur and why it needs to, how much is it going to cost, and what is a likely risk if we don't actually invest. So that's the way I sort of went forward.
Jared, you had a range of issues, though, that you had to deal with, from broken fences to kangaroos on the track, through to the legislation that stopped drivers in training from speeding. How did you come up with the solutions to problems like these, as varied as they were?
There was a number of things that needed to be looked at, but the first thing we looked at was like a holistic safety review. We're not the only people that do police driver training. So we did like a national scan, as well as looking at similar jurisdictions such as New Zealand and the UK to try to identify best practice. Get some form of independence. I did speak about that before. Independence is very important. So we went out and actually got a recognised driver training expert that was highly sort of recognised throughout the world. He's done stuff in Australia as well as overseas. I engaged our health and safety division and made sure I got an occupational health and safety consultant on board. And then created like a working group, like at Atwood, for argument's sake, driver training is the #1 user, but there is a number of other areas of the organisation at Victoria Police that use that facility. So we also had those in part of the working group. Like we didn't want to come up with solutions for us that would actually not be fit for purpose for other people that use the facility. You need to be sort of practical, like with what you come up with. You've got to understand that there is not an endless bucket of money, but also don't be too disappointed. Like, don't sort of stop what you're progressing if you're going to find out that it might cost hundreds of thousands or even millions of dollars. Some people just give up, just go, I'll never get the money. Like, report that sort of risk up and make the others above you make that informed decision. And you might come up with like a priority list where you do certain things one financial year, and then you get some more funding to do a bit more work. And as I said, it was well over $1 million with what I got, but it was over 3 sort of financial years to get there. I did understand that New South Wales and Queensland do actually have a driver training track that the police use. So what I actually did is I got my senior sergeant and myself, and we took one of our cars up to New South Wales. We'd spend a few days up there watching their training, as well as driving our vehicles at our assessment speeds on their track to see whether their track was fit for purpose and what we could actually bring back to invest in our sort of thing. In relation to the legislation, that was a little bit different. Part of the scan actually identified that 3 other jurisdictions in Australia actually have specific legislation to permit driver training to occur on the public roads with the police departments. So I actually then put that through our legal services division to see what they thought. They sort of said that we really needed to cease what we're doing, our current practices, and try to get legislative reform or take everything off road. So that was sort of the thing. But the issue that we had is that was a massive sort of repercussion for Victoria Police, because we had quite a significant number of people to train, and it wasn't just driver training that relied on that sort of exemption that we're under previously. So we got some further advice through Queen's Council, and they corroborated what our legal services department did, and that's how we sort of put everything through the police minister to get that change.
On top of that, Jared, your work involves a lot of very diverse stakeholders. How do you manage to bring them all along with you on this journey, especially when some of your work needs a lot of that funding or political support that you've been talking about? I understand you alluded to the funding a little bit there.
Yeah, so like with your stakeholders, the first thing I suppose you got to do is identify who your stakeholders are. And what I do is, like, when I run a project, is I actually put them against like a matrix where I look at things like their interests versus their influence. And then I identify those with the highest interest and the highest influence. And they're the people that you need to spend the most of your time sort of communicating with, because they're the ones that have the potential to either help you deliver what you're trying to achieve, or they can actually delay what you're trying to achieve, or they can actually even derail everything that you're trying to achieve. So you've got to keep these people on side. Things like identify who your business service manager is or equivalent in your organisation or agency, and get to know them and explain what you're trying to achieve. Get their buy-in. Have a good working relationship with your senior management, and get them to be, I suppose, your champion to or sponsor to put it up through if you need to go to the next level, whether it's executive management or the director or whatever the case may be, to get that funding across the line. And once again, I keep speaking about it, just keep bringing it back to risk. Like, that's all I ever report on is risk. Because really my managers want to know, like, what is likely to come around the corner and actually worst case scenario that they need to sort of address and be aware of.
Congratulations on everything you've achieved so far. The driver training unit now is a showpiece, which is outstanding. What's been the health and safety impact of this initiative for VicPol?
I suppose the biggest measure of success is that since January 2021, we've only actually had one serious collision on the road network. And to put some context, like the driver training unit travels approximately 1.4 million kilometres a year for Victoria Police. And the majority of that is in unmarked cars above the speed limit with no lights and sirens activated. So further context is basically we've gone around the world 122.3 times since that, and there's been one collision as a result of it. So I suppose that's the main sort of measure. So it's a lot safer for our instructors, it's a lot safer for our students, and importantly, it's a lot safer for other road users. So that's our main sort of measure of success. There's also that removing any ambiguity that we had with legislation. It wasn't really clear whether when our trainers were out actually on the road, whether they were fully sort of covered and exempt for the regulations for what they were doing. So getting that legislation embedded just makes it quite clear that they do have that sort of exemption to breach regulations whilst driving. There is a couple of unintended consequences as a result of that. Like, I actually saw that morale in the work unit greatly sort of improved. Like their suppose was quite dilapidated, their sort of facility and things like that. And to see that the organisation cared about them and was willing to invest helped that sort of morale, which also then had a flow on to decreasing things like unplanned leave within the work unit. And I suppose lastly, they'd been around for a number of years. I think it established in about 1958. And there was a bit of complacency that sort of crept in through the working from their day-to-day business. So it sort of brought safety front of mind, and it's now embedded as their day-to-day business.
Fantastic results. Great work with everything you've done there, Jared. Jen, if I could come back to you for a second. We've mentioned a selection of your projects. My final question to you before we get to questions from the audience, any common threads across them or tips about how to make them work?
It's interesting because I think there's some really common themes with what Jared was saying. And I think it's quite common across health and safety as a whole. And that is to promote a really good culture of reporting. And so for Gay and I, a lot of that has been getting on the floor. We do our environmental safety audit every month with the staff, and it was to really get the staff involved in that process. And so recognising where there are risks and, getting staff to report them as well as reporting them ourselves. And then when you start to actually see things changing, when staff see that there are improvements to safety, they become quite engaged in the process as well. Developing a really good rapport with management and a positive culture. So, really ensuring that everybody understands that, there is obviously a legal requirement, but it's also about wanting your staff to be safe at work. And so I think that's the key things for us. Is really to get the staff engagement, because the staff are the ones that will identify where the risks are. And so, if they don't feel comfortable reporting, they'll come and see us. And so we have a really healthy relationship now where to try and actually encourage managers so that they don't feel like we're just walking and saying, here's a problem, you have to fix it. But we do sort of say to them, this is a serious issue and it does need to be resolved. And there are serious ramifications if it's not. So, but it's always with a positive mindset of we really want to look after our staff. Yeah,
that makes a lot of sense. Thank you for that one. Next one, again, a lot of people wanting the answer to this one. Do you have any suggestions for getting the people to volunteer for the role of a HSR and designated work group? I don't know who's best to answer that one. I'm happy for anyone to jump in.
I think with 270 people in our initial designated work group, and the fact that we've demonstrated over and over again that we can make a huge difference. I can honestly say we've now got 2 anaesthetists, 2 HSRs and deputy HSRs, and 2 of our technicians who are HSR and deputy HSR. So there's 6 of us with this one big designated work group. It is difficult. The first questions that people ask is how much extra do I get paid? And of course that's no more, but you do get some protected time to finesse safety at work. And I think there is a little degree of celebrity there when you achieve things and make a difference. And I think that's been helpful to get more HSRs. Initially, I went back to being a HSR in theatre, coming and going because nobody else will do it, which is a bit sad. But we lots of encouragement, and I'm quite sure with mentoring, we will get some more interest, definitely, Cameron.
Yeah, let's hope so, for sure. Jared, I might steer this one to you. What barriers or challenges are preventing employees from fully adhering to our current health and safety protocols? And what can we do to eliminate or reduce these obstacles?
That's a bit of a tough question because I think it really depends on what sort of work you do and where you sort of work. I mean, for Victoria Police, for argument's sake, like we have some policies, especially in relation to pursuits and things like that. But then there's some certain, I suppose, resolution strategies which aren't sort of supported through policy. And I suppose occasionally, like, members look at the end goal and they look at the risk assessment, but ultimately they want to catch the offender or whatever the case is. So they're saying it's slightly outside of policy. So occasionally it might be things like, is your policy sort of fit for purpose? Does it need a review or a certain sort of change? But you sort of got to balance that like, what is the ultimate outcome that you're trying to achieve? And how can you do that as safely as possible? Yeah, it's a very sort of open-ended question because it could be really, you know, have you got fit for purpose systems and reporting throughout your organisation or agency? Is that sort of a bit of a barrier in relation to safety? Are you sort of under-resourced, so people sort of cut corners or whatever the case is just to try to get the job done with less? And sometimes safety might drop off as a result of that.
Yeah, great call. Thank you, Jared. Jen, I might steer this one to you initially, but please feel free to jump in, anyone. How can we change the culture away from doing safety audits or walkthroughs simply because they are ticking a box with a KPI? Sorry, I've just lost the rest of that question. It's gone off my screen. I'll come back to, there it is there. Versus actually considering it a tool and looking for gaps to improve on.
I think it depends on how you approach it. So with our environmental safety audits, we don't just walk around and have a clipboard and tick things off. We stop and we chat to the staff in the different suites. So like, I'll go to Theatre 1, I'll talk to the nurse in charge there, talk to the other nurses that are in the room, talk to the technicians on the floors. So we really kind of, it's an engagement process with us. It's not just filling in the checklist and you know, popping it away in the repository, never to be seen again. So we see the audit process as an opportunity to actually engage with the staff. We take the managers, we go on a walkthrough with our managers as well. And that's really good because the senior managers come who are not normally involved in the process with the health and safety matters that we have, like the day-to-day stuff on the floor. So it's a good opportunity to port out to them where there's particular failings. And it can be anything. It could be you know, somewhere where we've noticed that staff are having trips and slips and things like that. And, you know, we need to get this floor resurfaced. And, you know, we've had floors resurfaced and all sorts of things because we've been able to get the people further up the chain to come along on those visitations. So I think that it's how you approach the paperwork side of it. And so to actually make it an engaged process where all the stakeholders that are around you can be involved in it and can have their input. And then you have a much more robust document and you have evidence. And when you're having those conversations, when you're doing the environmental safety audit, that's that opportunity to encourage your staff to do risk bans about particular things that they've identified in the area.
This might be a really tricky question because I think in the cases that we're hearing from the three of you, there is some really good structure in place, but a number of people wanting to know this one. Most workplaces do not have HSRs. How can change be achieved without a HSR structure? Who
think
wants that
would
one?
be, oh, sorry.
Thanks, Gay.
Thanks, Cameron. I think that would be about reporting risk. If you want change, you have to go with evidence, and even if that's photographic evidence or written in the way that your organisation reports risk. And I think that without a HSR, that would be the only way individuals or as a group, people can get change. But I would certainly encourage a designated work group to form and find themselves a HSR. I can't say that enough.
Jared, do you
Can
have
I
anything
probably
to add?
add a little bit more to that, if you like?
Yes, please.
I haven't got a safety background, and I didn't really have a HSR as part of the work that I sort of did. So it just flows on from what was just said in relation to just identify it. Like, it's not really rocket science. People understand if there's an unsafe practice. But as I said, rather than just problems, come up with problems and the potential solutions and report that up through risk. And that's what I've always done.
Great. Thanks, Jared. Yes, Jen?
I was just going to say, I think the other thing is if an area feels that they do need a HSR, but no one's prepared to step up, I think because it can seem somewhat confronting to be one. So Gay is actually our HSR and I'm her deputy HSR. And so I think maybe if there is a couple of people in a department who are concerned about things, it may be easier to actually step up together and to take on that role. I think it's really good to encourage not just one person to be a HSR in an area, to have a deputy as well is really beneficial, because then you have that teamwork model together and you can support each other as you're going through the process.
Yeah, really good advice. Thanks for that, Jen. Gay, I think I'll come back to you on this one because I think you touched on earlier about issuing a PIN. It might have been you, Jen. I apologise if I got that wrong. So please, whoever wants to answer this, but a PIN or a provisional improvement notice is generally a last resort method to resolve health and safety issues in a workplace. Are you able to elaborate on why it got to this stage before management addressed the safety issue?
It got to this phase because finance. In public health, you have to account for every cent. And if money is diverted from one area, it may impact patient care. So we have to tread carefully. And it got to this point because I don't believe that our clinical managers were able to divert the money away from other places. And we'd come up with solution after solution and we couldn't progress forward. And then the provisional improvement notice was issued by both Jen and I at the same time. We'd filled it out, got some information from WorkSafe and our union and pushed the send button together.
Great. Thank you so much for that, Gay. Anything else to add to that one, Jen?
I think it's definitely not something that you do lightly. Gay and I, we took it very, very seriously. Like, only a HSR has the power to issue a PIN notice, like the only people in the entire state that can do it. It is a very powerful tool. I think, though, that when you have exhausted all other avenues and you cannot get a resolution and there is a significant risk to your staff, it's something that you have to do. But again, like I said before, it was very good, I think, for Gay to have the support of me sitting next to her when we did it, when we went through the process and when we got to that point and we were like, we have to do this. And yeah, it's like, I'm glad that we did it.
Absolutely. Absolutely. And this next question, perhaps for all three of you, maybe Jared, I'll come to you initially. Both examples operate in industries with a strong union presence. Would OHS strategies change in a non-unionised workplace?
I don't believe they would, because whether you've got a union or you haven't got a union, everyone's got a responsibility for safety. And I don't think there's a manager in the world that doesn't want their employees to go home safe at the end of the day. So if you can sort of show that sort of safety culture and why you need to, and what is there's significant risk if you don't do a certain course of action, then you should be able to come along for the ride. Surely, if you've got a really strong union that's willing to support and be a further voice, because they can have sort of direct meetings right up to your sort of director or chief commissioner, for argument's sake, in my situation. It just helps with that voice from a number of sort of areas. So it does help, but it's not the be all and end all.
Gay and Jen, anything to add on top of that?
I think Gay and I are both members of the ANMF, which is the union for nurses and midwives. I think what's really beneficial for us is that our union actually offers industry-specific HSR training, and that was really, really beneficial to both of us. And so I think that is maybe something that is helpful. But again, you can arrange training that is relevant to your own particular industry outside of unionised workforces. But I think that, yeah, definitely doing the training with ANMF was very beneficial. And again, when we were getting towards issuing the PIN notice, we did contact the Health and Safety organised or department at the ANMF just for a bit more advice and a bit more support as we went through it. But I think that it's not essential to be a unionised workforce. But I think for us it was probably beneficial. Gay, maybe?
Yes, certainly our feedback from Rashika at the time, which helped us finesse our PIN. I think that was having never issued one and guidelines not giving us quite enough information. And if you don't put the correct information on a PIN, it can be rejected. So it was good to have that feedback. But I agree with both Jared and Jen, we don't have to have a unionised workforce. But certainly for the things that you are not expert in, it's helpful to get feedback from your union.
Can I come to you, Jen, on this one? I imagine there would be a pretty entrenched hierarchy in a big hospital. How do you bring senior people along with you when the problem might be more in the trenches?
I think that it's definitely a case of approaching management in an open manner. We have a very good relationship with our managers, which we're very lucky to have. But I think that it's very much a case of not going in that it's adversarial, to have all your facts before you approach management and to arrange time to meet with them. Not to just bang on the door and say, hey, you know, there's a problem here, I need to fix it. It's to sort of say, like, you know, can we arrange some time? I want to talk about some of the occupational health and safety issues that we've raised or that we would like to raise with you, to ensure that you have evidence to support the claims that you're making about the safety that may have come, or safety that's come out of the audits and things that staff may have raised with you as well. So it's very much about, for us, it's been very positive, as long as we've gone to management with a positive frame of, you know, there is something here, we would like to resolve it, and to not expect it to be resolved there and there on the spot, to know that there are processes you have to go through and to be prepared to take the time to get to a satisfactory resolution.
Great, thanks for that, Jen. Now, this next question sounds like the three of you have a good, strong, positive relationship with the hierarchy in charge, but this is a question relating to perhaps those who don't. How can someone improve their confidence in continuing to report issues even when there is a lack of buy-in and sometimes a lack of respect? Maybe Jared, I could come to you on this one.
I think the first thing that you got to do is remain professional in relation to you know, I suppose those discussions, as well as whatever your reporting mechanisms is. Once again, like, make sure you have a strong evidence base. So use your systems to your advantage. Make sure that your members or your employees or whatever the case is, if there is things that are occurring where there are near misses, rather than just let you know, like, actually have it recorded on the system. In a small agency, if you've only got one direct line manager, it might be a bit more difficult if there's that sort of I suppose, not a great relationship between the two, but normally organisations have a few sort of managers, and don't be a lone voice. Like, get other sort of champions as well in relation to safety, and present like a holistic sort of issue or whatever the case may be to your management, and persevere. Like, the amount of people that just say, "Oh, don't bother because it costs too much money. There's no money, you won't get anything." I'm like a dog with a bone. Once I get an idea in my head, I just keep going and going and going until I basically get what I want in relation to it. But yeah, just do it professionally is probably my best sort of yeah, that I can put forward.
Great advice, Jared. Thank you for that. And perhaps flowing onto one of the points you made there, I might steer this one to you, Gay. How can we get staff to stop being reliant on others to action hazards they report and start getting them more involved in actioning them?
That's a very difficult one in a busy workplace. To be honest with you, it's got to be positive feedback. They can see that our peers have raised issues and that we have an algorithm of issue resolution, and that anybody can raise an issue and take that to management. And when they need support, they can ask for us to help them as well. They know that we're there for them.
Great, thanks, Gay. This one, just a clarification, perhaps. Can a OHS officer issue a PIN? Anyone know the answer to that one?
It's only a health and safety rep, is my understanding, according to the Act.
Okay, that's okay. Thank you for that, Jen. If anyone needs further clarification on that, I'll mention a little bit later, of course, WorkSafe's advisory line, but perhaps that's a really good point too. If you just any little detail like that you need extra information on, whoever asked that question, please give them a call. A couple more questions. I'm conscious of time, but and this one, perhaps I'm coming back to you, Gay, maybe you, Jen. It is concerning to see that it would take a PIN to enable change based on safety, but I'm happy to see the change. Are PINs needed more often to encourage management to make necessary changes? I feel our inspectors are willing to issue a PIN generally.
I think when you issue a PIN, you have to be mindful that it's a very powerful tool. And if you overuse it for things that could be resolved over a period of time, I think it's an abuse. I think you have to be careful, and you have to have gone down every step and every avenue where there is collaboration and suggestions for change, and then a PIN if we can't get any further than that, and there's no resolution, then a PIN is definitely needed. And sometimes your management can't pull finances out of the air. As I said before, and Jared also works for a government-funded facility, that every cent has to be accounted for in these places. And sometimes it's a tool that will help management get something over the line and reallocated funds as well.
Great, thank you, Gay. This next question I may need a little bit of help with, so I'm happy for anyone to jump in. I believe ARIOs, authorised representatives of registered employee organisations, are crucial in having safety issues addressed, particularly in workplaces that don't have HSRs. To be more effective, ARIOs should be able to issue PINs, etc., similar powers as HSRs. Is this being looked at? Can anyone answer that, or is that perhaps a question for WorkSafe directly? Lots of shaking of the head. Okay, that question there, and those who wanted it answered, again, suggest WorkSafe advisory line perhaps can give you some guidance on that one. I reckon I've got time for this one last question, and it is a bit of a challenging one. I'll steer it to you, Gay. How is it acceptable to use finance as an excuse in such a large organisation when, as a small business, that would not even be considered to be a reason for something not to be completed, rectified, or improved? We just have to get it done. There is no way to cut corners ever, but times are tough. How do you respond to that one, Gay, perhaps?
Definitely in a small business where there is risk and harm happening to your workers, issuing a PIN, finance is probably not a good reason, but we're talking about a company that I work in that services to the South Australian border. That's hundreds of thousands of people, and we're the biggest tertiary institution in Victoria, so outside of the metropolitan area. We do need to be mindful, and we need to work out ways to get redirected funds. It just doesn't come out of the air. And our resolution for the toxic chemical is costing the department about $200,000 a year. So it's not a simple answer, and finances are something that we have to take into account. And at the end of the day, if a person is at risk, that outweighs everything. It outweighs everything. It doesn't matter about the finances at all. We've just got to keep our workers safe, and they go home healthy and alive at the end of the day, every day.
Yeah, great. Thank you so much for that, Gay. I'll leave it there with all the questions because I am conscious of time, but thank you so much to everybody who did ask questions through the audience. Also, a huge thank you to our three panelists for joining us today. Gay, thank you so much for your time today.
Thank you, Cameron.
And big thanks to Jen as well. Really appreciate your time.
Thanks, Cam.
Both of you joining us from Barwon Health, and also a big thanks to Jared from Victoria Police. Thanks, Jared.
Thank you, Cameron, and thanks for those that came online and with the questions. Greatly appreciated.
Yeah, absolutely. We appreciate the three of you sharing your insights and examples today on making your workplaces safer. Well, we hope that everybody has found this an interesting and informative session. This webinar will be available on WorkSafe's website in the coming weeks, so look out for that if you want a bit more information from it. We certainly value your opinion on our Health and Safety Month events. Shortly, we will be sending you an online survey. We would love it if you could provide your feedback so that we can incorporate your suggestions in our program next year. All respondents will go into the draw to win one of 5 $100 gift cards. Shortly, we will also show on screen a list of all the contacts or programs that we have covered here today. If you have any requests for further information, we recommend you to please get in touch. And also remember, if there is something you want to discuss, there is the WorkSafe advisory line that I mentioned. It's open from 7:30 a.m. to 6:30 p.m. Monday to Friday. And also the emergency line is open 24 hours per day, 7 days a week. Thank you so much for being a part of this webinar.